this is Gloria again from hupella.com. We hope you liked our previous video where I explained what is PCOS, its common symptoms, and how it should be diagnosed. In case you haven't seen it, make sure you check it out on our channel. In this video, I'm going to explain the different PCOS phenotypes and some useful information science knows about these types so far. The phenotype refers to observable differences between organisms. For example, it can mean simply our eye color, or for example, blood type. So different types. For PCOS, it means that many women can be diagnosed with PCOS, but they can all have different symptoms. So currently we know about 4 different phenotypes. Classic type 1, classic type 2, ovulatory, and normal androgenic. Approximately 2/3 of the women have the classic type, so classic type 1 and 2, and the rest can have the ovulatory or normal androgenic. I'm going to explain all of these phenotypes more in depth now. Approximately 50% of the PCOS women fall into this category. This is one of the strongest type of PCOS. So this type has irregular period, cyst in the ovaries, and high androgenic level, so like testosterone. Basically, all criteria from the Rotterdam criteria applies to them. This type is also more likely prone to weight gain. So for example, be overweight or obese. Also this type is more prone to insulin resistance. Insulin resistance is a condition where your cells cannot take up sugar that circulates in your blood. But I'm going to explain about insulin resistance in another video. Also, this type is more likely have high anti-Mullerian hormone. Anti-Mullerian hormone is basically a marker for ovarian reserve. So when we're born, we already have a set of number for this anti-Mullerian hormone. So how much eggs we're going to release in our lifetime. And often this can be checked for women when they want to get pregnant, that how much eggs they have reserved. For PCOS, this marker is not very accurate because very often this is elevated. Also, this classic type 1 is more prone to hepatoxiosis, so a condition that affects the liver. Classic type 2, interestingly, have normal ovaries. So means that they have no cyst in the ovaries, but they still have irregular period and hyperandrogenism. Visual examination of the symptoms with this type is particularly important because sometimes they may exclude PCOS just based on the normal ovaries. So the visual examination can mean like checking for acne and excess hair growth, but blood tests can also be very important in this case to check for the hyperandrogenism. As the name suggests, the ovulatory types have regular period, however they have still cyst in the ovaries and they have the hyperandrogenism. Compared to the classic types, this is a milder form of PCOS. So these women are less likely to get obese or overweight, and also less likely to get insulin resistance. Also, if we compare the androgen levels, women with classic type can have higher androgens compared to this type. The name of this PCOS phenotype also gives us a clue. So normoandrogenic means that this type less likely to have elevated androgen levels. So if we carry out a blood test with these types, less likely to see elevated testosterone levels. But these types still have irregular period and cyst in the ovaries. This is also the mildest form of PCOS, so means that this is the type that carry the less risk for metabolic conditions, like for example, the insulin resistance or the obesity. Some research also suggests that this type very often have elevated LH levels or elevated LH2FSH ratio. So LH stands for luteinizing hormone and FSH to follicle stimulating hormone. So the LH hormone or luteinizing hormone is essential for egg release. So normally during a normal cycle, this hormone is slowly elevating until approximately the middle of the cycle, where it surges the most, so it's reaching the highest level. And basically this highest level is giving the signal for the egg that it can be released. That's when, for example, fertilization could occur. It could occur if there is a sperm around. So imagine if this surge doesn't happen properly. So for example, it's like constantly elevated, then this signal, this green light basically doesn't happen. So imagine the surge, this highest level is the green light that you can go. So this doesn't happen in this case, and the egg remains in its cycle, and that's what we refer to cyst. So basically there are eggs that were not released from the ovaries. The FSH hormone is working closely with these LH levels. Similarly, it's also working at the first part of the cycle and is helping the eggs to get mature, so for growth and development. And the ratio of the LH and FSH should be 1:1, but in PCOS this ratio is often 2:1 or even higher than that, and that means that they don't work in synchron, and this egg release cannot happen. It doesn't happen for every PCOS woman, so alone just this ratio and these hormones cannot be used for the diagnosis of PCOS. Don't worry, that can be absolutely normal. Remember, PCOS is a relatively new condition, so it's only been mentioned in 1935, so about 85, 90 years ago. And the diagnosis criteria only been set up 30 years ago. Now, I think it's also important to discuss how the different phenotypes and criteria being set up. Lots of doctors came together, they told their experience about PCOS, and basically that's how they mapped what type of PCOS there are. So one possible explanation is that we don't know enough of PCOS and we don't know enough of the phenotypes. So it's possible that you don't feel like you fit to any of these PCOS types. Or it can be also possible that you don't know enough about your condition. So for example, there was no blood test, or one of the criteria wasn't evaluated. Also, I think another important factor is that doctors say always different things. So once they say, yes, you have that many amount of cysts that would fit to the PCOS criteria, but others would say, no, you don't have that many cysts at the moment, so this doesn't fit to the PCOS type. I have the latest one that I've been diagnosed with like the mildest PCOS, and then so I had irregular period, and I had the cyst in my ovaries. But for example, later I managed to sort out my irregular period. I still have cyst in my ovaries, but sometimes doctors say, oh, you have regular period, you don't have that many cysts, so you look fine at the moment. So sometimes even I'm questioning myself if I have PCOS. I haven't had elevated androgens when originally I was diagnosed, but later on I performed another test, and for example I had elevated testosterone. So I think it's also really a lot about the timing. I strongly believe that the lifestyle management can influence PCOS, because I can feel it on myself when I eat lots of refined carbohydrates, or I eat less vegetables. I can feel it that I feel worse, like just on my everyday well-being. So I think it's really important also when we see a doctor. But basically we don't know enough about these PCOS phenotypes. So we need to do a lot more research. I think types are one of the issue that there is not enough research being carried out, because the different types are very heterogeneous. So it means we have different types and it's difficult to control. And in research, normally the scientists want to do a very refined questions. So very often actually these research were carried out to compare these phenotypes, and that's where, for example, I got these information for you today. But I think this is also one of the reasons they might not look into PCOS, because first they need to evaluate these symptoms, which can be expensive. So imagine they would need to carry out the insulin resistance test, the ultrasound, evaluate all these symptoms, look at the androgen levels. So it can be expensive. For example, I think personally some interesting questions that should be looked into are, for example, like how do we metabolize different nutrients? Is some PCOS phenotype, for example, digesting food differently? Because, for example, why some women are more likely obese, or are there differences in our appetite hormones, like how likely we get hungry, or from what type of food we get more likely hungry? So there are lots of questions. Later on in another video I will talk more about appetite hormones, but again it's the same thing like with phenotypes. It can be very different, and research finding very contradictory evidences. So just like in conclusion regarding the phenotypes, don't worry if you're confused. I think many of us feeling like that we are confused. Or do I have PCOS? Do I have, like, which type of PCOS I have? This is just for you as an information that there are different types. You might be able to say, oh yes, this is me, but you might be still confused which type you belong to, or which type describes you the best. So PCOS is often associated with obesity, but it's important to mention that approximately 20% of the women are lean. So this means that they are in the healthy range regarding their weight. But these women, even though they don't carry the excess weight, they can still have the regular period, the cyst in the ovaries, and hyperandrogenism. The reason it's important to talk about, because often people who are not overweight think that they don't have higher metabolic risk. Certainly, lean women have lower metabolic risk than obese, because they're less likely to be insulin resistant. But still, what research found so far, that even lean women can have insulin resistance and higher metabolic risk factor. So it's important that women with healthy weight still pay attention on lifestyle management, like exercise and diet. Very often the metabolic risks are associated with that lean women still have high fat circulating in their blood, so namely triglycerides and like LH cholesterol. So this can, for example, block insulin receptors for the cells because they're circulating in the blood, and insulin cannot effectively attach to the cells. But we don't fully understand why these women still have these characteristics. I think it's also important to mention that there's two types of lean women. One that are generally lean and struggle to gain weight. Again, can be due to various reasons. They might not be hungry often, or even though they try to eat a lot, they just don't gain weight. And there's another type where women are more likely prone to gain weight, but they just very health conscious, constantly paying attention on their lifestyle, eating healthily and stuff like that. I belong to this type, so I very often started to gain weight very rapidly, but I started to panic and I was like, oh my god, I have to pay attention more, and then I lost a bit. Now I can really well maintain my weight, but that's because I experimented. So I think it's also important to make these differences. But the conclusion here is that even if you are lean, it's important that you pay attention all the lifestyle management, because if you have the PCOS, you have higher metabolic risk factors compared to healthy women who don't have PCOS. We hope you like this video. If you haven't covered anything, or if you have any questions, feel free to comment under the video, and be happy to answer, or be happy to include it in our next video. In our next video, I'm going to explain the potential causes of PCOS. Also, if you like this video, remember to sign up to our channel. And you can also sign up to our newsletters at hupella.com, where we're sending out healthy recipes. And also, if there's a new video, we will be sending a notification to you. So hope to see you soon. Bye.